Okay, so it is January 8th and I just left my appointment with the nurse practitioner in IR and she said it looks like it's healing. I'm so happy. So the plan is for me to continue my wound care throughout the weekend, and then on Monday she wants me to give her a call and possibly text her a picture. Of course, finish my course of antibiotics, but if it looks like it's continuing to heal on Monday, then I will just keep doing what I'm doing. I'm not completely out of the woods, but she said it definitely looks like it's going in the right direction, but I'm already so relieved. I could tell last night when I was cleaning it that it looked like there was new skin developing on the outside of it. So anyway, yeah, I'm just so happy. And now I feel kind of silly for getting so upset about the whole situation earlier, but I was upset and I had every right to be upset. I don't know what I'm talking about right now. But anyway, just wanted to give that little piece of good news. So hopefully this will be it in terms of port updates. So I'll talk to you later. Bye. Hi, so it has been quite some time since I made that last clip. So today I thought I would talk about some lessons that I learned after having had that experience. And again, I just want to say that I'm not a medical professional. Every situation is different, and this is just my experience and my personal reflections on what happened. So if you haven't seen it yet, I will put a link up here somewhere to my video about my port experience. And if you watch that video, that may make this video make a whole lot more sense. So the first lesson that I learned is that if I could go back in time, I would have said yes to the port right away. My oncologist asked me if I wanted a port, and the way that I interpreted that was, oh, so there's an option for me to not have a port. And so just a little tidbit about me is I overanalyze everything. So when she asked me that question, in the moment I said, no, I don't want a port. My oncologist did say, you know, some people choose not to. You do have to get poked every time in that case. But she said, you know, it's your choice, rightfully so, because it is your choice whether or not to get the port. But in my personal opinion, I should have taken her up on getting the port placed as soon as possible. And I think the reason why I didn't say yes right away was because I really wanted to hold on to some sense of normalcy, and not having a port would have been a sense of normalcy. It would be avoiding a surgery, it would be avoiding putting a foreign object in my body, and that sounded really appealing at the time. So because I didn't change my mind about getting the port until a few days after I had spoken with my oncologist, I actually wasn't able to get my port placed until after I had my first chemo treatment. And when I received my first chemo treatment without the port, it actually did hurt a little bit through the IV. And I mentioned this in a previous video when I was talking about my very first chemo experience, and a nurse told me at a subsequent treatment of mine that a lot of patients say that it does cause a little bit of pain when you're just using an IV. It was not excruciating pain by any means. I think I rated it like a 2 or a 3 out of 10. So a couple pros about getting the port as opposed to not getting the port is that it does make things a lot easier in terms of not getting poked all the time. You do get poked in the port, but because you have a lidocaine cream that you can apply beforehand, you barely even feel it. One of the cons to not getting a port is that the chemo can actually affect your veins in a way that it makes you what nurses call a harder stick, meaning it's harder to find a vein to use for an IV. It sort of hardens the vein, and that makes it harder for nurses to access your veins for an IV. So another lesson that I learned is that in terms of my wound care regimen that I had to do after I saw the nurse practitioner in IR, she basically instructed me to wash it with some antibacterial soap. I'll try to show a picture of that antibacterial soap that I ended up using, because something that I might do that I don't think would hurt would be, once you are done with keeping the port incision dry after surgery, and when you do start showering again, is I would actually use that antibacterial soap just to be a little bit proactive in terms of making sure there's not going to be an infection there. I don't think that would guarantee that there would be no infection, but I don't know, just to be a little bit more proactive. Another lesson that I learned is that after my incision site healed, I did notice that one of the stitches was poking out of it, and if a piece of cloth like my shirt was over it, it would sometimes snag onto the shirt. So I talked to a wound care nurse at the cancer center, and her recommendation was to apply just a pea size of Vaseline on top of the area where the stitch was sticking out every night until the stitch came out. I did that one night, one little application of the Vaseline, and then the next morning the stitch was out. So those wound care nurses know what they're talking about. So one of the updates is I don't really know exactly what happened and why it was such an issue for my port incision to heal. There were some differing opinions as to what actually happened. One of the nurses had a theory that the incision was not closed tightly enough, so it was harder for my body to heal because it should have been closed a little bit more tightly. And then the nurse practitioner that I saw in IR actually thought that I hadn't kept the port incision dry enough after the time of surgery. So her theory was that the incision never really had the proper chance to heal because it got wet a little bit too soon. I did follow my post-op instructions, but I guess that's something that it's difficult, but you just don't always know the reasons why certain things happen. So another lesson that I learned is that when you do have the port, it actually doesn't hurt when you are getting lab draws. And the reason for that is I was prescribed a lidocaine cream, and you apply it over the port site, and then you actually take just regular saran wrap and fold it to be a little bit smaller but big enough to be able to go over the whole port. And after you apply the lidocaine cream, you put the saran wrap on top of it and then fold over your shirt to hold it in place. And what the saran wrap does is it makes sure that your skin absorbs as much of that lidocaine cream as possible so you get the full effects of it, and it also doesn't get all over your clothes. Another lesson that I learned is before the port placement procedure to ask any of your immediate family members if they have adverse reactions to controlled substances. That way, if you do, and assuming you are going to be given some sort of controlled substance for the procedure, you can ask to be pre-medicated. That way you can sort of help yourself in terms of after the surgery not getting sick, which unfortunately is what happened to me because I did not know that my dad has had adverse reactions to controlled substances. Another lesson that I learned is if you have young kids, you will definitely need help at home with the kids. So if that's your situation, I would make appropriate childcare arrangements. And I think that I was instructed not to lift anything over 10 pounds for 3 days, but really for me, it wasn't until day 4 or day 5 that I really felt comfortable picking up my 1-year-old. And the last lesson that I learned is that there is just no getting around it. This whole process with being diagnosed with cancer, it's an emotional roller coaster, and you don't know when the highs are going to be or when the lows are going to be. And just a lesson that I learned is to just ride the waves. In my last video, when I was talking about the port placement issues, I was at such a low. It was so hard thinking about the fact that I might have needed to have additional surgeries, and I think it's really important to allow yourself to feel all the feels so that you can process them and get through them and not just suppress them and hold them in. And then also just knowing this too shall pass. And, you know, sometimes in the moment you don't know if it's going to pass in the way that you want it to or in the way that you don't want it to, but it will pass. And I think that that's important to keep in mind. You will get through it and life will keep moving. So yeah, I think that that's all of my lessons that I learned about the port, and I'll talk to you in the next one. Bye.